3 o'clock on a Tuesday afternoon, and back again with another local business in our community. I'm Rob with Echo Properties, and we've been previewing businesses all day today. We started at 1 o'clock, 2 o'clock. Now we're at the 3 o'clock hour, and we're here with a local plastic surgery center surgeon, Lickstein Plastic Surgery in Palm Beach Gardens. It's located right there off PGA Blvd. If you know where Salute Market's at, it's right in that area right there. And I didn't say Lichtenstein, I said Lickstein. So these names are confusing. I'm getting messed up here. So I'm going to throw it right now to Jeff Lichtenstein, owner of Echo Properties, and Lisa Lickstein of Lickstein Plastic Surgery. Did I get it right?
Yes, good job.
Very confusing.
I actually had a story a couple of years ago. This lady calls me up and she's from overseas. And before she left, she leaves this message on her machine that she wanted to have some plastic surgery or some kind of an eye lift or something before she was going back. And I'm returning the message and it's going back and forth. And I'm convincing her that I'm Jeff Lichtenstein, the real estate agent. You don't want me to do your plastic surgery. So I looked up your information. You know, I knew you were out on PGA Blvd, and we had a good laugh.
That's great.
So did you ever get any calls for real estate, Lisa? Have anyone called?
Not real estate, but people ask if we're related fairly often. And we are very glad that Jeff has an excellent reputation and is well thought of. We appreciate that. Thank you.
So Jeff, take it away.
Yeah, so tell us a little bit about your practice and your background in plastic surgery, and what David does, what you do, and what your staff does, and also how you're coping with what's going on right now.
Okay, well, thank you. And first of all, thank you so much for asking us to appear. Truly appreciate it. David and I met in college and have been together since. We moved down here in 2002, and he joined a plastic surgery practice that was in existence. He's been in practice here since then. He's a board certified plastic surgeon. We started our own practice in March of 2017, and we are in the shops at PGA West, which is where the Palm Beach North Chamber is, and Salute Market. A lot of great businesses here around the corner of Central and PGA. We are very, very delighted that we had no staff layoffs. We have an amazing team there, very, very much part of our success story. And we offer both surgical and non-surgical and medically necessary and elective procedures, the full range from infants to seniors, and meeting the whole, we say, like a family practice of plastic surgery. So we see a lot of kids stitches lately. Kids are home and they're very rambunctious. And David actually came in on Saturday night to sew up someone who was in a tussle with his brother. But we're a safer alternative than the ER if you need that. We hope you don't, but call us. I think we're mostly known, as our tagline says, for world-class care and the welcoming atmosphere you deserve. We have patients that are world-class athletes. We have patients that are CEOs. We treat no one any differently. Everyone here is treated like we treat our family. Most of our staff has been with us for a very long time. And we're just trying to be really welcoming and reassuring here. I think for a lot of people, the idea of plastic surgery is scary. They have a desire to, as David would say, have their outsides reflect their insides, and it's hard to communicate that. And we try our very hardest to make that happen and have people feel very comfortable through the process.
What I liked, I was looking at your website, and I would encourage anybody to look at your website because it's just an awesome, it's an awesome website. But what I liked about it, some of the stuff was it had a little bit of, some fun to it, where there's a timeline of 20s, 30s, hey mama, in there. So it takes that scary part of it, I think what you're referring to, out of it a little bit, and makes it okay. And you start thinking, okay, this is some things that happen. But I was really impressed with David's part, where it's he really looks for the natural part of it, and not to make something look unnatural. Can you give a little bit of thought of your philosophy when it comes to that?
Absolutely. Well, I want to go back for a minute. David really trained at some of the best places that you can train. And he trained for 9 years after medical school. He went to Northwestern Med and trained at Tufts New England Medical Center, at Harvard's Mass General Hospital, full board certification, lots of continuing education. He's on the Northwestern University Medical School Alumni Board. But for him, this is really about making people feel comfortable. And every practice has a flavor to it. And he really tries to go with a natural aesthetic, with helping people look their best version of themselves, what they're seeking. We have on our website, you can download our practice guide that lists everything that we do with some real patient photos. So that's a good starting point to your discussion. And we're very happy to do virtual consultations. So you don't have to leave your home. You don't have to worry about COVID. You can schedule a virtual consultation right on the website. And we really make sure that everybody is listened to. Everyone has a different story, a different perspective, a different thing they're looking for. And it's not cookie cutter. It's not that we have, some doctors will say like they have a particular look and you can tell that it's their face. And what we want to do is have it be your face, not have it be our stock thing.
How did you both decide that this is what you wanted to do, and what's the enjoyment you get out of it?
Well, David, throughout his training, I mean, I was with him during, before medical school, but medical school, and he's was also a fully boarded general surgeon before he went back for plastics. He loved about plastics that you saw pediatric to geriatric, you saw cosmetic and medical need, that you could make a great difference in people's lives. And you could see them throughout their lifespan, and that you could improve their quality of life. He really enjoys and is very well known for his work with breast cancer reconstruction. And we do a tremendous amount of work with Komen, and to promote, each year we promote Breast Cancer Reconstruction Awareness Day with a big pink ribbon display in front of along PGA Blvd. It's very important to us to help people get back to feeling healthy and well. We remember a time when reconstruction was not part of the standard treatment for breast cancer. And so it's important to realize that women deserve to feel whole and have their body back after going through that treatment.
You've got an awesome message that David recorded that was one of the more impressive things of what you're doing. And just in terms of, you need to come with a mask. And if you don't, you have masks possibly for people. And then you're taking temperatures. I mean, there's just a laundry list. You're calling your waiting room the pass-through room right now, and it makes you feel very comfortable going in. I think safety. It's interesting. You just watch different businesses like Key Grill. We're doing an interview. They have in their parking lot 1, 2, 3, 4, like through 8, and they're delivering with masks and opening your car. And safety is so important right now. Expand on what you're doing.
Absolutely. So back in March, we ordered hospital grade. They're actually developed by it's NASA science, but we ordered 2 air purifiers they each cover about 3,000 square feet and circulate and kill virus with UV light. We have 2 of those in the office. When you have an appointment, you're asked to call up when you're in your car. You'll be given a screening questionnaire while you're still in your car. If it seems safe to see you, we will have you come up and take your temperature with a touchless device. There's a plexiglass between our front desk staff and the patients, so they are both protected. And then our staff will meet you right at the front desk and take you directly into your treatment room. Each staff that deals with patients is wearing both an KN95 mask and a face shield. And every room is thoroughly cleaned between each patient. some of the things are very normal infection control that any surgeon's office would do. You always change gloves between patients. You always wipe things down. I mean, there's certain things that always happen in a surgery office that don't always happen in a restaurant. So I want to start with that, is that we on baseline have greater infection control measures, because you should expect that of your surgeon. If you're not getting a sterile environment here, where you're going to get one. But we did get rid of our waiting room process. You know, there's no sit here at a lovely table or on a couch and have a coffee and that sort of thing, because we want to respect the social distancing, and we want to make sure people are safe. We're also really encouraging the virtual consultation. If we can see you virtually, we will. We only want you to come in if you need to. That said, a lot of people want to come back now for our med spa treatments. Those things are permitted again, and we would love to see you. So for instance, if you are getting lip injections, like we will have you HEBE cleanse your face, wash with a hospital grade cleanser here, and gargle with Listerine. Our staff will have a face shield and a mask and gloves. Everything will be completely sterile for you. And when you're done, you know, you'll walk right out. We can take payment over the phone. We can bill you. We really are trying to minimize all the touch points, and all the products that you would want to buy from us, you can buy on our website, or you can buy by calling, and we can send it to you. We don't need you to touch anything.
I saw that, you know, right now, you know, dollars are tighter, you know, for a lot of people, and that you have a point system. And you tell us a little bit about that?
So we have, I think, the best reward system in town. Also, our most common manufacturers also have their own rewards programs. So Allergan has the Brilliance Distinctions program, and Galderma has the Aspire program. And pretty much any plastic surgeon in town or dermatologist that sells those products, you can sign up to those programs. That's not unique to us. But we have our Patient Ambassador Rewards program. You get points every time you come in. You get points for a variety of things, and on your birthday month, you get 25% off of everything. But we try to give special promotions during the time that we were closed. That our spa was closed, we gave 25% off of everything, and we sold it online, and people were able to get some really great deals that way. We are also very proud of our community involvement. One of the things that our patients can do at every visit is nominate a 501c3 locally operating charity of their choice. And we have a box right at checkout, and you put your charity choice in there, and once a month, we pick out a charity, and we give them $500 in the name of the patient. We do a check presentation, and they're able to bring that to their favorite charity. We do that every month except November and December. We really focus and partner with Place of Hope and JAFCO to help children in need and teens in need foster care kids. And we, in October, partner with Coleman and try to help those under breast cancer treatment, or those who have survived, and make sure that those opportunities are available for others. And then in February, we partner with Impact at Palm Beaches, which is local women's philanthropy, which also our big emphasis is to promote things that benefit our local community. And the rest of the year, we just pick one out of the patient nominees.
And so there's another thing I saw on the website. What in the world is the Lickstein Lift?
So the Lickstein Lift is our proprietary procedure. It's registered in the Patent and Trademark Office. And it is actually non-surgical. Not everybody wants surgery, and not everyone needs surgery. But what we found is that people have heard of Botox, or they've heard of laser, and they'll come in and they'll go like, oh, I want Botox, but they don't really mean they want Botox. They mean that they're unhappy with what their skin looks like, or they feel like they look older than they should. But that the treatment for those things may not necessarily be what they've heard of, or just that one thing. So we've come up with a very customized set of procedures that use our full arsenal of things available to us to help rejuvenate skin, and people look dramatically younger. It affects the general appearance in terms of age and tone. And people just, they're happy with it. But it is both using the cosmeceuticals and injection and laser in a particular order based on that patient's needs, to make sure that they get the outcome they want. It's a big investment. You want to help people achieve the outcome that they're looking for. You want them to be happy when they're done.
What is there going to be any takeaway that you take from this? Things that you've learned that'll stay after this period is over?
Well, I think a big thing, not so much that we've learned, but that it emphasizes that our team is phenomenal. And that we have the right people working here, and they will take great care of you, whether you're here in front of them in person or on the phone or on your computer. You will be cared for by people who are superbly trained and who truly care about your well-being. So I would start with that. I would also say that people really, it is possible using technology to have the caring part come across. We were concerned about that. It's always easier to communicate face to face, but if it's safer to communicate not that way, that's a thing. And also because part of what we do has to be done in person. We offer facials, we offer massage, we offer all these things that really you have to be there to do, that those things together, all of the extra safety precautions that we've taken, we're going to keep a lot of them. I mean, hopefully at some point there is a vaccine and maybe you don't have to double shield so much, because it's hard to hear people through an N95 mask and a face shield, to be honest. It's particularly, if you have—
What did you say?
Yeah, exactly. So we hope that it's not forever, but a lot of the other procedures, the policies and that we're implementing, that we hope to keep that, just to keep everybody that much safer. And it really makes you focus on what the patients want. We were able to really see what are people purchasing from home and what is it that they need. And it's also been wonderful, honestly, Jeff, the kind of the things that you're doing now, and we so appreciate it. We've done a lot more B2B. It helps you appreciate, small local business, helping small local business. And that's a tremendously important thing as well. We've had great success working with our chamber, and we partner with Salute all the time. And we look forward to working with you. And
we're local, and it's supporting local is people buy. We talked about this. They don't buy a house; they buy an area. And if they like what the community has to offer, and it's made up of all sorts of different things of why people really are here first before they end up. I mean, they obviously, people like the beaches and proximity to an airport and all those things are important, but it's really, a community that becomes the most important piece of it.
Absolutely. And for us too, in terms of we give a lot of our time, we volunteer a lot. David's vice chief of surgery at Jupiter Medical Center. He was president of Meyer Academy. It's now Meyer Prep. For several years, we really tried to make sure that we're as involved in our community as possible. I know you do as well. It makes a difference to people, and you learn what's important to your patients.
Is what is there any services that you're not doing at this point? Like is massage happening or?
Actually, we have an important guest here. So Jeff, David was seeing patients, but David's here for the day.
Great, how are you? I was watching your video earlier. I thought it was very impressive and
great.
So he was asking if there was anything that we are not doing in the office given COVID, and we are now officially back.
Yeah.
So eyelashes, massage, all of those things come with, I'd say, enhanced consents. People really need to understand that we are taking every measure possible, but we can't promise you that you won't get COVID if you're in an environment with people outside of your home. But we are doing everything we possibly can. And all of our professional or providers have really taken the recommendations of their own societies our massage therapist knows what the standards are for his profession in terms of handling that here. And everyone, like I said, is masked, is sanitized. For facial procedures, we have, oh, he just left, but it's like almost at the dentist, like a thing that directs the air.
So what are can you list the surgical things that you do, such as massage and facials?
Sure. So our esthetician does micro needling with a product called Vivace, which is radio frequency micro needling. We have something called a salt facial, which is a misleading name. It is a pretty serious procedure using salt and light. It's not cozy like a facial. We do hydrofacials. We do microblading, which is an eyebrow treatment. We do Nova lash extensions. We do massage, and we do cool sculpting. We also do laser treatments. We do broadband light treatments, BBL. We do Halo, which is a phenomenal treatment for the skin. We do laser skin resurfacing. And we do a full range of injections, both Kybella, which is fat reduction, particularly for like this area, and fillers and relaxers. So we do the full range. And again, in the right combination, they all make a tremendous difference.
I was laughing. I remember once it was this character when I first started in business working for my dad in the textile business. He said, I got a gobbler. Got to get rid of the gobbler. But we've interviewed, I think, 60 some odd businesses in here, and what you're doing and how careful you're doing and everything, and how well thought out it is. It makes one feel extremely comfortable in no matter what the procedure is, in how you've minimized everything. It's really terrific.
Thank you very much. And I just want to say too, David is, I'd say like personally, like he grew up in South Florida, so he's a big Heat fan, and I'd say like a suffering Dolphin fan, like all the Dolphin fans. I'm hopeful this year though. But he's a big Pelotoner, so he's almost up to his 500th ride. So we're gonna have a big promotion around his 500th ride. So if you keep on our socials, you'll have an opportunity to get $500 off of things. So that's a good thing. And we are growing. Actually, we are going to be adding a doctor this summer, and we're just we're very excited to carefully and healthfully get back to our new normal and help everyone look as good as they can. I know I'm looking forward to seeing my colorist soon, and I hope that all of you stay healthy and well. And very much appreciate this opportunity. Come and see us.
Rob, will you put the, if you haven't done so, can you put their link to their website in the comment section?
I have it right in the post right above us. So if
you do?
watching,
okay, yeah.
Right above us.
Check the website out. It's a fun website. It's really well designed, but it shows how much care that they and thought they put into their patients. I mean, you can know right away with it, and it lays everything out, and what they're doing with COVID is, I think, just phenomenal.
Thank you.
You mentioned the one thing that interests me, and I've heard about it a bunch now. I've heard a bunch of people talk about, what is cool sculpting? Can you just tell me what that is? I've heard a lot about that.
Cool sculpting is a phenomenal thing. So your fat freezes, your fat can be frozen to death at a warmer temperature than your skin would freeze. So like, you don't want to give someone frostbite, you don't want to kill their skin, right? But the science of this is basically you sit in a chair and you can read your iPad, we have a TV, you could take a nap, a lot of people do, and water and a magazine, whatever you want to do while you're resting. Each treatment is a half an hour long. And they are a series of clamps, all different size. So they're shaped like this, and some are very little and some are maybe that big, and whatever fits in the clamp. So, if you can squeeze that on the side of you, if you have a little roll you want to put right in that clamp, the clamp does not hurt. But you have to lie down so it stays on. You're in a chair, a treatment chair. And we have 2 machines, so you can get done both sides equally. And you sit there and it freezes the fat, and then your body eliminates those dead cells the same way your body eliminates all other dead cells. So between 3 weeks and 3 months after your treatment, your body will eliminate those cells and you will not have those fat cells ever again. That doesn't mean that you won't gain weight again. It means that those fat cells are gone forever. So if you continue to overeat or have a metabolic problem or any reason that you gain weight, your other fat cells can still expand, but those fat cells are gone. People get dramatically, just such impressive results with it. And it's completely pain-free. There's absolutely no, like you go right back to work, nothing hurts. Sometimes people are a little red. I've had it done a bunch of times and really have had nothing. If you've had hernia surgery, you can't get it done. If you're pregnant, you can't get it done. You know, there are certain contraindications, but most people can get this done. The thing is that it's not a substitute for large scale weight loss. It's to help people with those stubborn areas that even, you know, you're working out and you still have a little roll here. You still have a little more to pinch than you want here. You could use another 2 months to get into your bathing suit, that kind of thing. That can be achieved with cool sculpting, but you know, some things need a tummy tuck or liposuction. They're just too large of a amount of fat to remove. But it's
me and Rob have no clumps or clamps or rolls.
It's that love handle, as we call it. I call it
exactly. And
wait till you get to 50.
Okay. Well, thank you.
Well, and then I just want to say, you know, again, Lisa, thanks so much for coming on today with us. And you know, business in our community, they're local, they live here, you know, they give back to the community a lot. You've heard the different ways that Lickstein Plastic Surgery gives back. And, you know, we need to support local businesses like Lickstein Plastic Surgery, and not to be confused with Jeff Lichtenstein and Lickstein. Don't call Jeff for a tummy tuck.
I won't do any cool sculpting or any of that stuff. You don't want it.
All right, but Jeff, if anyone calls needing a realtor, we're going to call you.
There you go. Yeah.
That works. That works. So we will not do tummy tucks. We don't do that. We'll send it to you, Lisa. And if you have any real estate, anyone looking to buy or sell, call us.
Absolutely. Jeff, Rob, thank you so much.
Yes. Thanks for joining us this afternoon. And we'll be back at 4:00 with our last business of the day, Tranquil Radiance Spa. So join us at 4:00 today, and we'll preview another local business. So thanks so much, Lisa, for joining us. And Jeff, as always, have a great afternoon, everyone.
Take care.
Bye.